Good afternoon. Welcome to the Special Superintendent's Webcast on July 21st, 2020. As always, thank you for joining us. I know we're starting to conflict with some staff retreats that you're having. I heard from several of you that you may be unable to watch this live, and we hope that you're able to watch this as all of these webcasts are archived and saved for later use. Also, feel free to make sure members of your team have access to it, the tape version of the webcast. It may be beneficial for them as well. We also continue to welcome our special guests to the webcast as we normally have, members of the Kentucky Non-Public School Commission, Executive Director, as well as the Catholic Diocese representatives for those schools, and then, of course, the various K groups that represent school boards and superintendents and administrators, our co-op directors, and others, including KHSAA. So welcome. We will get right to it. We have, of course, another packed agenda. We do have a hard stop today at 4 o'clock because, as you all have heard, and unfortunately, the governor has had to restart and continue the daily webcast due to the increased numbers of COVID-19 cases in Kentucky. And we know that almost on every not webcast, but press conference. On every press conference, there's something relevant, or at least a question the governor addresses relevant to public schools, particularly as we are entering into the reopening phase. So we will get you out of here on or around 4 p.m. today, but we're going to have to move quickly. We're going to try to get all your questions answered. Tony, do we have the slides? Here they come.
Yeah, they are coming.
All right.
All right.
We want to start out by just talking about, we've had some questions over the last few days from some council for school districts and others about just what are the expectations and requirements for opening school and what are best practices. If you'll see on this slide, the Healthy at School document that we released, I guess, almost 4 weeks ago now, that we're calling our flagship document in conjunction with Department of Public Health. That's the document, if you recall, that goes over the major expectations, the major public health expectations that must be implemented by schools. That's language right out of that document, strategies that must be implemented by schools. Now, is this a regulation? No, it's not. It's non-regulatory guidance, but when we say must be implemented by schools, that means that in the opinion of the public health professionals in Kentucky and in the opinion of the Department of Education and the Commissioner of Education, these are the things that must occur to reduce the risk of COVID-19 transmission in order for you to conduct in-person school activities. So for some reason, if you do not plan on implementing one of these items, then we'll have to have a conversation. And we had a conversation with the school district this week because there was, and it was a good discussion, a discussion about temperature checks, for example, and whether or not that was a best practice or whether or not that was a requirement. It is a requirement in Kentucky. It's my understanding it's a requirement based on the analysis I just gave you. It's non-regulatory guidance, but it's what we are saying must happen for you to safely conduct schools. You must check every student's temperature upon entry to school in various 3 places: upon entry to the bus, upon exit of the bus, or upon entry to the school doorway. Another thing that must be implemented to ensure that we're taking advantage of risk reduction strategies, cloth face coverings, masks must be worn, except in very limited circumstances when social distancing is 6 feet or greater and students are not moving, for example. So just wanted to go over that with you again. We have not made this regulatory. We can make it regulatory through an emergency regulation, but we believe all districts are acting in good faith. And even though we may have discussions back and forth, that's healthy about some of these issues. And so know that you all are going to continue to observe those using good faith and to the best of your ability. Will you catch every student every day on a temperature check? I'm sure there's going to be a student sneaks in a back door. I'm sure you may inadvertently miss a student here or there. Of course, that's going to happen. There's going to be some human error involved. There are going to be some students that are taking their masks off, and there are going to be some students that are not practicing social distancing, but we're going to act in good faith to try to make that happen. And of course, then the best practices that are also outlined in that document and in the other guidance documents. These are things that that would be great for you to do in a school district, but we know that they are not required, but they are considered, of course, best practice. And if you can do them, if you have the resources to do them, if you have the time to do them, then of course we want you to do those. So just want to go over that briefly. You all are doing a great job of this already, and understand that it's a very difficult time for everyone, and a lot of uncertainty out there, which we'll touch on or go in more depth on as we go on to the webcast today as we near the reopening of school. And then also we're having an increased number of cases across the state. So let's get started with the agenda. Don't forget the Go Soapbox as usual with your questions. Feel free to submit those questions. Tony, we will have a brief communications update and start with you.
All right. So first thing that I want to go over, as always, at the beginning of every one of our webcasts is the overview of all of our guidance that we have issued for our schools and our districts on reopening schools. Obviously, since May 15th, as you all are well aware, these are all of the guidance documents. There are links to every single one. I will go through and scroll through, including the 3 documents that we issued this week that you will hear about on this webcast. You all are seeing my screen, correct? I just want to make sure.
Yes, yes.
Okay. And then I also wanted to make sure that you are aware that we have now translated our flagship documents into 6 languages, including Chinese, with our partners at the University of Kentucky. And so we're very proud that we've been able to do this. Our top 5 languages spoken in our Kentucky schools, as well as Chinese with our partners at the University of Kentucky, and also the posters, which we'll talk about next week. And you guys should have links to all of those. Those are on our COVID-19 page. Congratulations to the 24 Teacher Achievement Award winners. These are going to be finalists or semifinalists for Kentucky Teacher of the Year 2021. Congratulations to you if you have one of these teachers in your county. Also, we have selected the 19 new students for the 2021 Commissioner Student Advisory Council. This was a very tough process this year. I can tell you we had over 146 applications, and just a very difficult position. I wish that we had a spot for all 146 kids, and hopefully we can, hoping that we can find room in other ways for student voice throughout this year. But congratulations to these students if they are in your districts. Wanted to let you know these are the superintendent profiles I was telling you about. The first one that we did was Mr. Leon Smith in Russellville, also Todd County, and then today we rolled out Sally Sugg in Shelby County. And then this is, Kevin, if you want to talk a little bit about this, this is the Reopening Kentucky Schools virtual town hall that we are co-hosting with the Lieutenant Governor and Cabinet Workforce Development on Thursday.
Yes, we're going to have this town hall. This is also open to superintendents, of course, and this is while geared toward the presentation will be geared toward certified and classified staff. It is also will be open to the public, but we had heard, we know that you all are doing a good job communicating, but with your employees and your communities, but we have heard, and the Lieutenant Governor has gotten some feedback, just a lot of questions. They weren't criticizing local districts, but a lot of questions about the state level guidance. The guidance document we began the broadcast talking about, the healthy at school guidance, social distancing questions about that. And we're going to have Dr. Stack on the town hall, like Dr. Stack has been on some of our calls to talk about the reason for contact tracing and how that can be helpful, how that makes being in school while we have the tool of contact tracing different than we had back in the spring. It makes it better, and that we can pinpoint cases, whereas back in the spring when this started we could not, and that we may be able to surgically isolate pockets of cases and not close entire districts or schools down because of that. Explaining those types of processes. We're also hearing that there were some rumors going around in the faculty and staff ranks about that SBDM authority has been waived, and of course you all know it hasn't been waived and it's still in effect, but we wanted to use this as an opportunity to communicate with them at the state level, answer those state level questions about that guidance document, social distancing, contact tracing, also just provide a very high level overview of the guidance documents available on the KDE website, where to find those, and then the other resources available. And we view this as a supplement to the communications that you already are having and that you will be having and continuing to have as you get closer to the reopening of school. So I hope you all will be able to join us for that as well. We've already opened the Go Soapbox for that and have already received many questions. And we're not going to be diving down into local reopening decisions and questions about that. Those are we know you are handling those issues and communicating those issues in your own way, through your own social media, through your own town halls or other avenues that you have. So again, this is just to, again, I don't think you can over communicate. If you feel like you're over communicating, and this goes for your efforts as well, you're probably doing it right. And so it's another effort. We have the ability, we have the technology to do it through the media portal. So we wanted to have this opportunity, and hopefully it will give some reassurance to staff out there. I know there's a lot of anxiety, and then that in turn, you all are dealing with that as well as you're having these conversations locally. And we're going to hopefully use that to allay some of those fears and concerns about the state level guidance.
There's also, Kevin, just wanted to refresh that there's also the Google form that is also available for questions if they don't feel comfortable using the soapbox. Either one will be accepting questions in advance. All right, and then move on to our first two guidance documents with Greta Hilton and her team.
Hi, thank you, Tony, and thanks, Commissioner. Good afternoon. We have just yesterday, out of the Office of Special Education and Early Learning, released two new guidance documents. One is the considerations for reopening schools for exceptional learners and preschool students, and the other is the differences between compensatory education and extended school year. So first, before we jump into discussing more about these guidance documents, I want to pause just 1 second and say how appreciative that we are in the Office of Special Education and Early Learning, or OSEA, for all of the folks out there that serve students, all students, and particularly students who are exceptional learners and preschool students. There are some fabulous people out there on the ground as a result, and I've shared this many times, and I try to share it every time I'm speaking to anyone who works with students. But as a result, Kentucky has yet again received a meets requirements on our annual determination from USED, which, for lack of a better way of saying it, is really our annual report card for how we are providing services across the Commonwealth for students with disabilities. We were one of 22 of the 60 states and entities to receive this. It is, it's the highest rating, and it isn't the work that's happening at the state education agency. It's the work that's happening across your local districts and in those regional cooperatives and even early childhood regional training centers. And so we just want to take a moment and celebrate your work and tell you to take a moment and celebrate your work as well and pat yourselves on the back. So with that said, We will jump into these guidance documents. And folks, there's just really not a lot of simple answers when it comes to safely reopening schools, particularly as we work with more diverse populations and try to meet the unique challenges faced by all of our students. It's a much more complex approach when we're working through individualized programs, particularly in this time of uncertainty. So with that, please know that the guidance that we have provided is based on the guidance that we receive as a state from the Office of Special Education Programs at USED. And please know that it's an ever-changing landscape. So as we continue to receive additional guidance or additional, if there were to be any additional changes to the IDEA that would indeed require an act of Congress. So I don't foresee those. But if that were to happen, obviously it could change some of our guidance. The other component that we need to think about is, as some of these questions and challenges move through due process, either dispute resolution or in litigated cases, it could result in changes to our guidance. And as those things happen, we will certainly update our guidance as we go forward. So all that to say, we're looking for 2 guiding questions as we go through today. We really want you to think about the greatest barriers for reopening schools when you're considering exceptional learners in preschool, and what suggestions do you have for overcoming those barriers? Because we not only want to provide guidance, but we are active learners, and we want to hear from districts as well who are boots on the ground doing this work, so that we can share it either in our special education spotlight or across the listservs, or however. We want to be able to get those great practices out to all other districts so that everyone can learn from their peers. Next slide, please. So as we go through today, there are a couple of overall considerations that I just want you to be mindful of as we think about the considerations, particularly for students with disabilities. And these are just high-level overarching concepts. Know that any changes that is made to a student's IEP, it must be individualized. It must occur through the admissions and release committee. Broad sweeping changes based on the requirement or based on the challenges presented by COVID is not appropriate for students with disabilities. If we're talking about specific programming changes to their IEP, that still has to be an ARC decision. Overall, the IDEA hasn't changed. The implementing regulations haven't changed. We are looking for flexibilities wherever the IDEA allows that, but I will tell you it's not a lot. So in many of these situations are going to be case-by-case situations that we're going to have to work through, and ARC teams are going to have to work through that. As we consider moving, students or parents, I should say, are presented a choice of whether they return to school in a virtual environment or a face-to-face environment, or even a hybrid model. Keep in mind that those are location changes and not necessarily placement changes that would be determined by data based on least restrictive environment. So those are just some, and FAPE, I almost forgot that. That's the most critical component, is that as students move through this uncertain time, a free appropriate public education must be continued for all students with IEPs. The IEP in a virtual or a hybrid setting may look different than an IEP in a face-to-face setting. But again, IEPs wouldn't be changed simply to provide a convenience for adults, but rather, the ARC team may convene and say, let's say, for example, little Greta is receiving an hour a day in a collaborative setting for individual or specifically designed instruction in the area of math. But because we may not be offering that through the virtual model, then maybe it's a one-to-one instructional model offered, online. And so then it may be less time because I may be able to provide the same level of support to little Greta one-to-one as I would have if I needed more time in a collaborative setting. So those are just some things to think about. And one other thing before we jump into the, looking through the document, there are some other concerns around maintenance of effort and some flexibilities that were provided by OSEA regarding the period of available federal funds. So I'm going to pause and let Chris Thacker talk to you briefly about the funding components.
Thank you, Greta. Greta mentioned that there is the potential, or not the potential, but the allowance by the U.S. Department of Education for states to require a waiver to extend their IDA funds for an additional year. This was specific to funds first awarded on July 1, 2018. So we're looking at funds that would have expired this September 30th. Once we got that notice from the OSEP, the Office of Special Education Programs, and the U.S. Department of Education that this was something we could do, we immediately applied for it and shortly thereafter received the ability to extend those funds for another 12 months. That may not impact too many districts as you're already 2 years deep into those funds, but for those of you who may still have a remaining balance, there isn't that pressure at this point to spend those out in an immediate fashion. One of the concerns, though, that we have right now refers to maintenance of effort. And I'm sure that if there are any finance officers or directors of special education on the line, that you're probably experiencing some issues or concerns about how we're going to maintain effort in providing special education and related services to children with disabilities. As you may know, maintenance of effort requirements speak to continuing to provide special education related services from a combination of state and local funds or local funds only that meets the highest level that you have used in years past. With the fact that schools pretty much went to the virtual or NTI environment in March, it's very likely that there has been a reduction in some of your expenditures, especially if you provide much special transportation since that went away. So you want to be careful when you start looking at the expenditures that you've been incurring and what fund source you've been using to pay for those special education expenditures. I know a number of districts, well, all districts pretty much received funding under CARES for either ESSER or GEARS or both. And with the ESSER funds, you may have been tempted to use some of those to pay for special education costs. You may be tempted to have paid for special transportation. You may be tempted to use those to pay for compensatory education if you've got there yet. But if you've done that, you may be putting yourself in a position where you're spending less state and local dollars than would be necessary to meet the MOE effort once we start looking at the 1920 school year to look at the expenses from that year to determine if you're in compliance. So be very, very careful in reviewing what your expenditures are. It may at this point, if we're looking at the 1920 school year, require going back and perhaps doing some vouchers to correct some of those expenditures to make sure that you are meeting that effort, because we don't want any districts to fail to comply, which would mean we might have to return some funds to the U.S. Department of Education in the amount that the failure may have occurred. We are also looking forward to funds coming up for the current year to be approved. We have a number of districts that have already probably received their approval for the 2021 school year of IDA funds. If you've not submitted your application for those yet, make sure that that is completed very shortly so that those will be available to you when school begins. Greta, I'll turn it back to you.
Okay, thank you, Chris. So I'm gonna pause there and just again throw out the FATE piece. And as you think about through those ARC team meetings, as you think about ARC's discussing the offer of FAPE, the one thing that I think is most critical for you to be thinking about is that the ARC is they're charged with the accountability for making that offer of FAPE, and then the district's required to implement the offer of FAPE. It is incredibly important right now, especially during this time, that you think about alternate ways to do that. As I said a moment ago, broad sweeping changes to IEPs don't result or don't occur as a result of the COVID pandemic. And a couple other of the most challenging questions, or the most challenging concerns I think you're going to face as you move forward, especially in those hybrid models, is how to ensure that all students have, or all staff have the availability to provide the services that students need. It's going to be extremely challenging moving forward to find time. And I don't think there's any easy way to say that or any easy way to think about that, other than to know that, we're still talking about individualized instruction, and we're still talking about the requirements of the IDEA, and some students with disabilities and or 504 plans, or preschool students, they're going to need they're going to need a lot of extra support, especially during this time. And so, moving forward, I think that's going to be, your leader's most difficult decisions. So with that, thank you, Tony, for pulling that slide up on the screen. That's helpful, but I think we got through all of those major considerations for you to think about. And again, those are just high level things to think about as you move forward, and as special education staff and directors of special education delve deeper into the how to implement these requirements. I will stop there and turn it over to Veronica Sullivan, who is the director of the Division of IDEA Implementation in Preschool, and she will walk you through the first guidance document.
Thank you, Greta. Tony, can you go back just one slide, please? There we go. Thank you. All right, so I'm going to talk to you a little bit about the guidance document that was released yesterday. I'm just going to give a high-level overview of the document. Hopefully, you've had an opportunity to look at that document since it was released yesterday, but if not, this will give you just an overview of what's in that document and some of the reasons why that information is in there. So first of all, the document is really in response to questions we received once the Healthy at Schools document, or our flagship document, was released. And people had questions about how to take that information and put it in context for exceptional learners and preschool students. And so through our field work and through our regional organizations, we collected questions and we tried to respond. So this is not going to be the end all be all. There's a lot of information that may change, or there's things that you will have even better ideas than we had in this document. There are a lot of innovative educators out there, so we just tried to respond to the questions that we had, and so this is not all encompassing. And obviously we would love to hear from the field as we move forward about ideas that you have, and so we can share that across the state, like Greta said. So just a quick overview, there's 4 sections to the document. Reopening considerations, which is the area I'm going to talk to you about today. There is also a question and answer section for preschool students and for special education students. And then there are some resources. So next slide, please. All right, so I'm going to talk to you about the reopening considerations and the social distancing area of the document. And we just, like I said, took questions and we tried to provide scenarios and options for educators to think about as they're reopening or making the reopening plans. And, just a reminder about differentiating for exceptional learners and trying to make sure that we're giving students practice. So that was a point that was highlighted within the document. And then we had a lot of questions about what to do when students require staff proximity closer than the recommended 6 feet. And so as all of you are, I'm sure, aware, there are students who have complex needs, and they may require some one-on-one assistance. And this may call for students and staff to be closer than the recommended 6 feet. And we try to highlight some of the more common, and obviously there's going to be more situations that will occur because there's so much individualization with this population. But we try to highlight those areas where it was most common. And so we talk about assistance with toileting or hand-over-hand instruction when you're physically transferring students, feeding, and then those instances where a physical restraint is needed for the safety of the student or the safety of others. And so we provided scenarios of really talking about the appropriate PPE, and some examples that we use were, if you're attending to the hygiene needs of a student, some things you would need to wear would be gloves, mask, a face shield, and from the information that we've been given, face shields alone do not provide enough protection from aerosols produced by the nose and the mouth, and so we wanted to convey that information. And then also, it's recommended that students wear a mask when they're receiving those close supports. And then we also wanted to encourage schools to think through situations. You know your students, you know their needs, and really think through situations where there may be additional PPE that's required, and then consult with your local health department if you have questions about whether or not that's the appropriate PPE. And then talking about preschool students, we had a lot of questions about social distancing within the preschool classroom. And on June 29th, there was a document released about facilities and logistics, and it has a calculator, which is a really effective tool for districts to access in order to determine the class size and how many students can be within that space. So that was provided in the guidance document as well. And then really talking about itinerant staff, because with this population, we have staff that typically move around, possibly from classroom to classroom, building to building, to support students and provide their needs. So there's some information in there about that as well. And then the next area I want to talk about is special transportation, or those students who are identified as a T5 code in Infinite Campus. And the big thing I want to hit here is that with transportation, there's been conversations about how many students to put on a bus, full capacity, and there's a lot of information out there, but there may be an option where you may request a parent of a T5 student or a student who has special transportation as a related service in their IEP, where you may ask that parent to transport that child. And if you do so, you just need to remember that you have to ensure that it's a mutual agreement that that parent wants to do that, as well as the parent is reimbursed for all transportation costs. So we wanted to highlight that as well. And then really thinking about food and snacks. I know there's a lot of plans going on with cafeteria and how you'll feed students, but we just wanted to remind districts as you're planning that there are students who may have food and drink identified as an accommodation in their IEP. And so you'll need to think about those students in your reopening plans. And one example of that would be a student who may need to have a food or drink at any given time because of their disability, and they will need to have that on a bus, for example. And if there's a broad sweeping plan that there will be no food or snacks on bus, you'll need to make sure that the staff are aware that student can receive that food or drink on the bus. And then the preschool environment, snack time is very common in the preschool environment. And so we provided some information about eliminating family style serving and really going to one staff member who serves the students to mitigate the spread of germs when you're giving out that food. And then another section here is about instructional experiences in the community. And we just really wanted people to think about ways you can find alternative opportunities for students to still engage in this. But even though some of the guidance is recommended that you don't travel, we wanted you to still consider ways of providing this, and also to let folks know that it isn't necessarily required that you have amendments to an IEP or to a gifted student service plan in order to continue these services. And we wanted to give some ideas and options for that as well. Next slide. And then least restrictive environment, there's a section in there talking about placement versus a change of placement versus a change of location. So I recommend that if you haven't looked at that section, that you look at that as well, but also really to think about the fact that it isn't necessary that every student have an ARC after to discuss LRE, but there are some students that will require that. So we just want you to be mindful of that, and that information is in the document as well. And the next section I'm going to talk about is mask. So this is a hot topic. I'll say we've got lots of questions about this, and I think we continue to get questions about this. So we wanted to provide as much information as we could at the time. And again, please don't hesitate to continue to send us questions, because we know this is really difficult and challenging. But according to the Healthy at Schools document, students who are enrolled in first grade and above and staff should be required to wear a cloth face covering unless medically waived. So in most cases, students with disabilities should be able to wear a mask, but there are some instances where they may not be able to due to their age or their physical condition or potentially their disability. So the questions around whether or not, what to do if you do get a waiver, so we try to address that. That's in the question and answer section of the document. But if the school receives or the district receives a waiver from a medical professional, there's no need to have an ARC. You can go ahead and implement that immediately. And then, we've had questions about particular students that the district is aware that this may be a challenge for the student. And so, there's nothing to say you can't have an ARC. If you've got information that the ARC has enough data that they can make that decision, then you can have an ARC and discuss that potential waiver. And again, if that's what the ARC decides, then that could be implemented. And then there's a section on health policies. We touched on health screenings. By no means are we experts on health screenings, but when thinking about students with disabilities and young learners or preschool students, you need to be conscious of wait time and then having some plans in place if students are not able to tolerate waiting in line for long periods of time, whatever that screening process may look like. And then we had questions about assessment for eligibility and identification. And so there's just a few tips in there about things to do in order to have access to materials that may be used by multiple students. We also talk about preschool centers, and that, again, very hot topic. We tried to give some examples, some things that we had heard from the field, some great ideas, thinking about ways that preschool centers can be safely utilized. And so there's a couple of examples in there in the document talking about grouping students to rotate in pairs and having individual supplies. And there's a list, but by all means, again, this is not exhaustive. Reach out to your colleagues, reach out to your early childhood region training centers for ideas. We can't think of everything, but we tried to share what we did have. And then the last section I'm going to talk about is contact tracing, and it's really about documentation and scheduling. It talks about just, again, giving districts some ideas as they're planning of what to be conscious of, thinking about if you do need students to transition to receive services, how are you going to document where they've been, what they've touched, what they've had access to. So really thinking that through. And if you have staff that are transitioning, really thinking about how you document where they have been and what they have had contact with. So again, I just went over the reopening considerations. There is a question and answer section and some resources, and please continue to submit your questions. Next slide. And here is my contact information. Again, Veronica Sullivan. Or if you would like, you could also contact our policy advisor, Carol Ann Morrison, and we'll be happy to assist you with questions. Next slide. I'm going to turn it over to Sylvia Starkey.
Hi, everyone. My name is Sylvia Starkey, and I'm the Director of the Division of IDEA Monitoring and Results in the Office of Special Education and Early Learning. And today I'm going to talk to you a little bit about another guidance document that we released this week. And it discusses the differences between compensatory education and extended school year services. We've had a lot of confusion between the two, and so we're hopeful that this document will provide you with the information that you need to help to clarify those with your staff. Next slide, please. While you're thinking about the compensatory education and extended school year services, the guiding question I really would love for you to think about is what supports do you need when you're determining compensatory education and extended school year services for students with disabilities? Next slide, please. When you look at the document as a whole, you'll notice that there are 4 overall sections. The first section is really going to talk to you about what we call FAPE, which is a free appropriate public education, and how that looks during remote instruction. The next section is a section about compensatory education, and then there's a section about just extended school year services. Following that section, there is a table that compares the two side by side so you can see what the differences are. After that, you'll see that there is a one pager that just is important things to remember for each that you could share with your staff. And then following that section, there are question and answers. There's actually 2 sections of questions and answers. The first is on compensatory education, and the second section of questions and answers answers questions that are related to extended school year services. Next slide, please. When we talk about FAPE during remote instruction, it's important for you to remember that regardless of the instructional delivery model, whether it's in person or virtual or some sort of hybrid in between the two, regardless of that, the local school districts do remain responsible for providing FAPE to students with disabilities. As a result of the inability to provide face-to-face instruction, there may be certain special education and related services that are difficult or even impossible to provide during times of remote instruction. A good example of this are things like orientation and mobility services that have to be provided face-to-face when your district is closed for NTI. Those kinds of things might be things that became difficult during remote instruction. When special education and related services are not provided in accordance with the IEP, regardless of the reason why, it may result in a denial of FAPE. And the remedy for failing to provide FAPE is compensatory education services. The goal of compensatory education services is not to punish districts. It's really just to place the student in a position that he or she would have otherwise been in had there not been a denial of FAPE. Next slide. When we talk about compensatory education, there has been a big difference in how people want to talk about it. A lot of people call it compensatory education, and there's another school of thought about alternate language, such as recovery services, unfinished learning, lost learning, post-COVID instruction. You'll hear lots of different ways that people have used it. So recently there have been lots of discussions within the education community that using that term compensatory education feels like local districts are being blamed for doing something wrong and could jeopardize relationships with families. As a result, some of those alternative terms that we've talked about have been introduced as ways to discuss missed services without using that term compensatory education. Terms such as unfinished learning, lost learning, post-COVID instruction often are being used as synonyms for compensatory education. In OSEA, we're really just discouraging districts from shying away from that compensatory education discussion. However, there may be some district staff who feel more comfortable using alternate language during those kinds of conversations with families. However your district chooses to address that conversation, it's going to be really important to acknowledge that any services that are designed to place the student in a position that he or she would have otherwise been in, but for the lack of educational benefit, which resulted from a denial of FAPE, is indeed a compensatory education service. Next slide. When we talk about compensatory education, it's defined by case law. You won't find it in the Kentucky administrative regulations. There's lots of litigation that has really shaped compensatory education. Like we said before, punishment of the local school district is not the purpose of compensatory education. It's typically awarded as a result of an IDEA dispute, or it could be offered as a voluntary remedy by a student's ARC, which is an admissions and release committee. If your district knows that there may have been a denial of FAPE, we would encourage you to voluntarily offer to go ahead and try to fix the things that you know how to fix to help you prevent any kind of disputes in the future. When you're talking about compensatory education, it's going to really be important for you to remember to review those decisions on a really case-by-case basis. It wouldn't be appropriate to offer every student with a disability the same compensatory education. It may not necessarily be that every student needed that as well. Awards have to be reasonably calculated to provide educational benefit, and the eligibility for that, it can be extended beyond graduation or age 21. It just cannot be used to pay for post-secondary education. Next slide. So the next section is really going to talk to you a little bit about extended school year services. Extended school year services are defined in Kentucky administrative regulations as specially designed instruction and related services that are provided to a student with a disability beyond the normal school year in accordance with the child's IEP at no cost to the parent. When you look at compensatory education, there's a case that's called Kenton County School District versus Hunt. And it has really shaped the extended school year regulations. The first case actually is mentioned in the Hunt County case, but we provided you with a direct link to the original case. And they talk about how to establish that ESY, which is what we call extended school year services, it's the acronym for that it's necessary to provide a student with a FAPE. It's going to be incumbent on those proposing the ESY for inclusion in the child's IEP to demonstrate in a particularized manner related to the individual child that ESY is necessary to avoid something more than an adequately recoupable regression. More specifically, it must be shown that ESY is necessary to permit the child to benefit from instruction. ARCs must consider things like the student's tendency to regress, their prior regression, their ability to recoup lost skills, and any kind of progress they're making towards their educational goals. Next slide. When we think about extended school year, it's important to remember that nearly every student regresses after summer or extended breaks, and not all students with disabilities are going to qualify for ESY. Students who do qualify for ESY typically have a likelihood of significant regression, very slow recoupment. The ARC is going to be responsible for planning the type, the location, and the amount of those services that are to be provided by the student. Those decisions are made by the ARC on a case-by-case basis. Local school districts cannot limit the provision of ESY services to specific disability categories, and they can't unilaterally limit the type, amount, or duration of those services. Next slide. When you continue to go through that document, like we said before, you'll see that there is a side-by-side that lays those two documents, compensatory education and extended school year services, side by side. And they'll talk about things like what are they not, when and where can those services be provided, when a student would become eligible, what are you looking for, how do we determine the amount of services for each one, and how to document them. For compensatory education, it's going to be important to remember that you do those during an ARC meeting in the conference summary notes. And for extended school year services, you'll also do those in an ARC minutes, but those are actually documented within the IEP itself. After that, there's a section about important things to remember. And like we said before, it's just a one-pager that you can produce to staff to help them remember the differences between the two and the things that they need to remember. And then after that, you'll find questions and answers for both compensatory education and extended school year services. On this slide, you can see my contact information. Again, my name is Sylvia Starkey, and you can also contact our policy advisor, Carol Ann Morrison, with any questions you may have about this document, and we'll be happy to get back with you and answer them. Thank you guys so much.
Greta and team, as always, thank you. Great information. Let's stop here. Tony, do we have any questions related to compensatory ed, extended year services, any of the other special education topics?
Yes. Hold on one second. I'm going over to the soapbox.
While Tony's pulling up the soapbox, there's a couple of things that I just want to call your attention to as we move forward. And again, thinking about students with disabilities, things that are going to change as we go through dispute resolution processes. And some of my counterparts in other states are already seeing, in highly litigated states, I should say, are already seeing due process occurring as a result of disagreements. Kentucky is not a highly litigated state, and really I think that's because of the open lines of communication that districts have with families and parents. So I think now it's even more important than ever to continue that. And also, folks, as we're moving forward, because there are so many of these questions that there just aren't simple answers to, it's so important to reach out to us, to colleagues, to RTCs and co-ops, and mostly important to reach out to your local health departments to help think about finding creative solutions to some of the most challenging problems for individual students, because we have to continue offering FAPE while also making sure that we don't inadvertently cause problems within the public health community. So, and then the other thing I do want to call your attention to, last spring when we swiftly transitioned into NTI across the state, we advised districts to work toward an alternate form of FAPE because it was so fast, and that was the guidance that we had been provided from OSEA. Following up, with conversations with OSEA, they have shared with states that, we've had time now. We've had some time to think about those contingency plans. We've had time to move forward. And I would say that the same is true for districts. You've had time to think about how to implement FAPE in the fall. Granted, it may look very different, but it's still a form of FAPE that's based on individual student need. And so many of you, I think, have gone to work really quickly and created those contingency plans. Contingency plans is not a requirement, but it will certainly help you should you have to change course midstream as we begin the next school year. Tony,
Okay.
I'll turn it over to you for questions.
Okay, sounds good. So the first question is, does school-based preschool need to follow childcare guidelines for class size of 10? Wait, sorry, that one. Yeah, well, we haven't gotten to preschool yet. So I guess, we'll just go ahead and ask this one since I already started. We are not considered a childcare facility, but rather a school with a preschool as part of its system.
So we actually, the preschool considerations were at the very initial part of the presentation, but we have folks from the preschool division on the line. So I think Bill Buchanan is with us and eager and excited to answer preschool questions.
Thank you, Greta. Yes, and thank you for this question. It's a very good question in terms of how to do this. And so what we would say is that for this is to go ahead and I've lost my train of thought. Let's see. The question has to do with the class size, right?
Yeah. Does school-based preschool need to follow childcare guidelines for class size of?
Yes.
They say that they're not considered a childcare facility, but rather a school with a preschool as part of its system.
Yes, correct. So what we would recommend is that you use you did the guidance that we currently have, for like the room capacity calculator to determine, the class size.
Okay. All right, can you all hear me?
Yes.
Yes.
Okay, I wasn't sure. I was getting an error message on my Wi-Fi, so I was hoping that was not the case. So, the next question: a student has a medical note that they do not have to wear a mask and they attend school, but they are in a classroom with medically fragile students. Who is then allowed to attend school in that classroom?
I think we've touched on this question before, maybe not as it pertains to students who are in classrooms with medically fragile students, but I believe we have advised to not discuss excluding students from school, whether or not they can wear a mask. Now, granted, if you have medically fragile students in the classroom, you're going to have to provide all kinds of additional precaution. And if a student, regardless of whether he or she is in a classroom of medically fragile kids or any other classroom, if a student is unable to wear the mask, it's going to be even more important for districts and schools to continue the mask wearing of all other adults and students, and the social distancing, the sanitization, and all other CDC requirements and Department of Public Health requirements that are in that flagship document.
Okay, the next question is, if a student is deemed medically ineligible to wear a mask, is it legal to move that student to a 100% virtual learning environment?
We would advise against not moving the student simply because he or she could not wear a mask. As to the legalities behind that, I can certainly defer to Todd to provide us with more information regarding that. Obviously, I'm not an attorney, but I would not send a student home because of the inability to wear a mask.
Greta, this is Todd. I would agree with you on that. Whenever you have a student who is requesting an accommodation in this sense to not wear a mask, because that is the expectation for every student entering the building, that should be handled consistent with other 504 procedures that you would handle when individuals make a request for an accommodation. Students make requests for accommodations within your building. So the first step would not be to exclude that individual from the classroom, but instead to determine how they can be accommodated to remain in the classroom. Now, you may have some parents who perhaps want or request a remote environment, and that's a different story than excluding the student based on their inability to wear a mask.
Sorry, I was muted. Next question is, they want to know, if we wash hands before and after, can we still use sand or sensory bins in preschool?
Greta, this is Bill. Yes,
Sure,
and yes, thanks. So to say that the guidance says that we do not recommend the use of sensory tables, and that if it can't be cleaned, you shouldn't use it. So instead, you may want to use individual bins for sensory items. That's what we would recommend.
Okay. The next question is, if choosing virtual instruction, can a parent require PT and OT to come to their home?
So this is Veronica Sullivan. So we've had this question in the past, and there is guidance that was put out by U.S. Department of Ed about COVID-19. And, well, that's really an individual decision based on the district. And what their guidance says is, while schools may choose that it's safe to provide that, they also need to do what is feasible or safe for their particular district for those in-person services. And although Greta talked about that alternate form of FAPE, how we really do need to move in a direction to have those contingency plans in place, we also need to do what's safe. And so that's really a decision for the district to decide. Again, your local health department may need to be contacted as well.
All right. Preschool teachers must assist in feeding for all preschoolers. Do they have to wear a gown and face shield during each meal with the group, or does this apply only to feeding of children with unique health needs?
So again, our guidance was put out as intended as guidance. There's nothing that says that you absolutely have to put a gown on. Those are recommendations that we have based from that flagship document. I think that would be a question for your local health department, or for, what do you feel is safe, depending on the students, obviously.
All right, the next question. I'm looking to see. CDC recommends no mask for children under 2, but KDE guidance states grade 1. As a district, can we mandate masks for pre-K and kindergarten? In parentheses, more restrictive, but not less than.
Yes, you can be more prescriptive. We're somewhere in the middle where the states are. We're, as the question says, we are any student above kindergarten required to mask. There are some states that are, I think, grade 4 or grade 5 and above. So I think we're somewhere in the middle. Robin, Kay, others want to comment on that?
That's correct. We talk about students that are kindergarten or below are not required. So that's just not required. If the local school district wants to make a different, more prescriptive decision on that, then they are free to do that.
Okay. Next question here. LRE, school policy states that if a student chooses remote learning, they have to continue until second semester. Is this a violation of LRE? Parent wants the option to choose when to attend in person and when to attend virtually.
So when districts are providing those options for families as to whether or not it will be remote or face-to-face or hybrid models, that isn't an LRE question. That's a change of location. And again, we're going to have to be a little flexible, not only as districts, but as parents and family members, because we're in an unprecedented time. So in thinking about that, the thing that I would caution districts about a little bit is that if you're thinking about, if you're offering all of those options and a parent says, for example, that they would like their student on a virtual, in a virtual location, but the district believes that there are services that the student must be present in order to receive. And an example of this is orientation and mobility services. So oftentimes O&M, the only way you can provide certain O&M services is face-to-face. So if the district has a face-to-face model available and the parent refuses that model, then as with any other refusal, and I think I saw a question, and this will answer that question as well, as far as picking and choosing what services that a student receives. If a district believes that you have to be face-to-face to provide those services to a student and a parent refuses to go the face-to-face model for whatever reason, then districts are going to have to honor the parent's choice, but they need to conduct an ARC meeting and provide prior written notice to say this is what we believe as an ARC that Little Greta needs, and these are this is a notice of our proposed action. And then if you're unable to provide those services, then that's where you start having those compensatory education conversations on the backside, because right now we have to adhere to the public health guidelines and try to keep everybody safe first and foremost.
Any other questions related to this topic, Tony?
Yes, here I am talking with my mute button on, sorry. I can't tell if this one is related to special ed, but I think it is. So I'm going to go ahead and just put it out there. Our district is trying to limit the number of individuals coming into the building. Can we offer parents the option for a virtual meeting?
Absolutely. As a matter of fact, I think that's really to be encouraged. If you can do that and the parent has the ability to do that, I think it works better for the family as well as the district.
Okay. I'm scrolling down here. Okay, number 2, another question. If the ARC agrees the related service is required to provide FAPE, but the parent still refuses to participate, etc., do we continue to document the attempts?
Yes, and I would recommend that the district convene an ARC meeting and again go through providing prior written notice and document the attempts and then document the amount of services that the district was unable to provide.
Okay. Next question is, can you please clarify the time requirement for preschool? The statute states minimum 2.5 hours, 4 days a week, or a program that meets community needs.
Okay, this is Bill. I can clarify. I can discuss this a little bit, right? So with the preschool program, there are 3 options for program operation. One would be a standard half-day, 5-day-a-week program in single sessions, a half-day, 4-day-a-week program, either in single or double sessions, with a 5th day for services to children and their families. Things like home visits, parent education, so on. And the third option would be a locally designed program approved by the commissioner. So what we would say is we're working on this and want to provide additional guidance around this issue, but above all, that preschool plans for scheduling should align with district plans for reopening.
Okay. Next question. Can we sanitize while students are in the classroom, i.e. sanitize manipulatives between center rotations?
I think we answered this or something similar, right?
The sanitizing in between stations and rotations?
Tony, this is Kay. And I think from just a disinfecting, sanitizing standpoint, the main caution here is to be careful about what products you're using. There may be some sensitivity that the students have to a particular product. So again, we encourage the use or individualized manipulatives as much as possible. But if you have a product that's not going to be harmful to any students with special needs, there's nothing to preclude you from using that. Just be careful.
Okay. Question, is it a violation of FAPE or LRE to require a student to stay virtual for the semester when they elect it?
I think I'm a little confused by the question. So I think the question is asking that if the families choose to go virtual, is there any issue with them requiring it to last for a certain period of time? And if I'm on the right track with my interpretation of the question, then again, I don't think the violation of FAPE would be what's to be considered here, because FAPE can occur whether it's in a virtual environment or not. So no, I don't see that as being a violation of FAPE. You just have to be sure that you're continuing to provide FAPE to that student in a virtual environment. So for example, if the student has certain specially designed instruction and supplementary aids and services, those need to be continued as written in the IEP.
Okay. Next question is, can a state-funded preschool classroom have some students attend only half day and some attend full day? Or do we have to offer full day for all students if we are providing it for some?
I think we probably need to research this further. With that said, I think we also would say we want to be as flexible as possible, and that it may make sense to have this option available where you provide both half-day and full-day preschool options, especially if it's meeting the teaching and learning needs of at-risk preschool students and preschoolers with disabilities.
Okay, we can flag that one just to follow up as well. Next question is one more that I can see, and then we can move on to the.
Fine.
Do we allow parents to, quote, pick and choose what they want to receive via teletherapy? We don't allow this for in-person instruction. For example, they want special ed and occupational therapy services, but don't want speech therapy.
That goes back to what I was saying a moment ago about providing prior written notice if you're unable to provide a type of service in a specific location. However, I don't anticipate that we're going to see tons and tons of families picking and choosing or wanting to pick and choose services. Should this become an issue, my advice would always be to go to the ARC team, have the conversation, provide prior written notice if you're unable to provide a certain type of service in a specific location. But again, a couple of takeaways from this is that, and going back to the question that Bill just answered, is that basically anything that's afforded to a student without a disability must be afforded to a student with a disability to avoid inadvertently discriminating against a student on the basis of a disability. So we just want to be mindful of that and mindful of the role of the ARC and the 504 team for students with 504s and the GSSP for students who are gifted and talented. And with that, Commissioner, I will pause and turn it over to you. And again, thank you for allowing us to be here with you this afternoon and share additional information around exceptional learners and students in preschool.
Great. Greta and team, thank you. You all will also be hanging around the webcast in case we continue to have questions come in at the conclusion of the webcast and the final question and answer. So thank you. Next, we have a new guidance document regarding daily participation and non-traditional instruction. David Cook with KDE's Office of Continuous Improvement and Support. David?
Thank you, Commissioner, and good afternoon, everyone. It's good to be with you. Guiding question today for this part of the webcast is what supports do districts need to implement the participation recording and reporting requirements in 2020-2021? Next slide, please. So as you all know, because of the emergency regulations that were passed by the Kentucky Board of Education, we will not be reporting student attendance during the 2021 school year. We will be in place of that, or in lieu of that, recording participation in the Infinite Campus system daily. We'll talk a little bit more about the differences between the entry daily and the recording daily. So that's a little bit of, I think, a confusion that's popped up a couple of times. You still, obviously, for students who will be in-person attendance, be collecting attendance every day for safety reasons, but you won't be submitting that as part of any reporting so that you can get your funding. Your funding has been decoupled from the attendance functionality and replaced with participation. Next slide, please. So daily participation, just as in a definitional way, is the interaction between students and teachers. Those interactions may vary from whether the student is participating in person or in a remote situation, a virtual situation. It's the measure of the student's engagement in the process. It is not a measure of the quality of student work. That's what grades are for. So we need to remember that participation is not telling us that student A did quality work. It's just that student A did work. So you will be recording participation for every student every day in the IC system. but because of the way the emergency regulation was written, you can do that recording on a weekly basis. So if you have students who are you're using a paper-based process with, and those students are submitting a weekly packet, for instance, you can enter the participation at the end of that week. You don't have to enter it every day, but teachers certainly can enter it, but you will be entering something every day that's in your district calendar. Next slide, please. The regulation that was passed by the State Board of Education last week defines non-traditional instruction as remote instruction in which the student is learning at a location other than the traditional classroom using digital or other alternative methods of learning. That's an important thing that we wanted to point out today, because there's a lot of terms that float around: virtual, digital, remote, distance, blended. All of those things would be all considered non-traditional instruction under this definition. So it's not simply a day in the calendar that we call an NTI day. It's a type or a way of instructing students away from the classroom based on this definition. Next slide, please. So again, non-traditional instruction days are the way you all have thought about NTI in the past, and you will continue to have non-traditional instruction days just as you did in the spring. The thing to remember about NTI days is a very specific type of non-traditional instruction that you use when you close the school to all students for in-person classes. We will talk in just a second about the different ways that you would do instruction that doesn't involve the use of an NTI day, because it's a portion of your students or a portion of an alternating situation where they might be in a hybrid situation. Next slide, please. So many of you have talked and have worked with our Office of Education Technology and our digital learning team about your concepts for virtual academies, whether those virtual academies are separate entities where students are enrolled outside of their normal school and classroom schedule. You've also talked about academies that are schools within a school, virtual learning in a general sense, which would be kids who are still with their classmates and following their normal schedule, but they may be doing it from home. So there's a lot of different things. I just wanted to point those out, a couple of really quickly here. A full-time virtual school student. If you've had any dealings with our digital learning team, you know that a lot of districts and the thought of your school having something like this is very prevalent in your plans. So that's when a student is fully enrolled in a separate school, virtual school environment, other than their traditional school and traditional schedule. Then you have school-based virtual, which is more of the idea of a school within a school where students may still be with their teachers, but they're still fully virtually enrolled. So you're thinking in terms of their schedule being all from home rather than a portion of it being at school. Next slide, please. Blended learning is what I think a lot of you have been talking about in your plans, and that is when you have sort of a approach that might be considered hybrid or AB, or any of those models that might be some students are there on Monday, Wednesday, some students are there on Tuesday, Thursday, and then everybody's virtual on Friday. So that's kind of what we think about when we think of blended. So they're going to get some in-person instruction, but they're also going to have virtual instruction. And then on Fridays, basically, you're going to have an NTI day because everybody's going to be virtual. The last one I put on here is important to note when you're thinking about NTI days, that, and remember all of the things that I've just described, these last four options with the full-time virtual and blended learning and the school-based virtual, are not talking about a day in the calendar designated as an NTI day. They're talking about instruction that is non-traditional. The last one here is partial school closure. I think it's very possible that you might have situations where you get back into an face-to-face environment and you have a particular school or particular grade level where You might have a spike in cases where you have to quarantine or shut down a school or a grade but the whole school is not affected by that. But maybe they're in another wing or something like that. So there are going to be times when you have to think on the fly about smaller situations than the entire district. So just a thing to remember as another type of non-traditional instruction. Next slide, please. An important note for you all for the coming school year, and I think many of you already knew this. In the past, NTI days were requested post NTI day. So obviously in a normal traditional way, non-traditional instruction happens for weather-related things. For instance, you don't know when it's going to snow, so you can't build that into your calendar. But as I just mentioned in that hybrid model, it's a great example of your calendar that you submit here before the year starts, having days, NTI days already built into it, like a Friday situation where you did AB Monday, Wednesday, Tuesday, Thursday with your kids, and then everybody goes remote on Friday. That would be considered an NTI day, and you could put that in your calendar on the front end. We're doing that for this year only. We're allowing you to enter NTI days into your calendar. Next slide, please. Okay. Types of daily participation. So you're in Infinite Campus and you're recording participation for your students. For students who are in person, it's pretty simple. Participation is basically the substitution for attendance. So what you're going to be doing in IC is recording that student was there. That's your participation. They are just like you would if you were reporting attendance to KDE, you're reporting participation through Infinite Campus. Next slide. The regulation, the emergency regulation, lays out 4 options for recording participation daily for a student who is remote in their learning process. And so it can be any one of these things every day that a student's in remote. It could be one thing one day, one thing another day, so forth. The first is one-on-one communication through video chat or telephone call between the teacher and the student, or the teacher and the parent if it's a younger child or a student with disabilities, and that's the method that needs to be handled. It could be a group video chat or telephone call where a teacher either talks to the whole class or a portion of the class through using a learning management system or other video conferencing tool. It could be students' time logged into the learning management system where they're working on their assignments. So a teacher could look at that and check that student as having participated. And finally, it could be a student returning a packet of instructional materials that are paper-based when they don't have access to digital work, the digital opportunities at home or in their situation. Again, that's the one that precipitated the idea that while you record it in IC Daily, you can wait until the end of a week or any other point in time to actually do the recording. You don't have to stop every day if that doesn't make sense for a student who's doing a paper packet that you don't see. Okay, next slide, please. One of the things that we've been noticing most recently, and it's a reminder for folks that Infinite Campus has laid out in the last month, and over the next month they will even lay out a little bit more about their blended learning functionality, which is making all of these models that you all are trying to think about doing much easier to handle in the Infinite Campus system. So you're going to be able to create groups. So if you're on an AB model, you're going to be able to have the Monday, Wednesday kids in a group, the Tuesday, Thursday kids in a group, so you can shift them inside Infinite Campus. You don't have to, it's going to be easy to record the participation. And I say that because as much as possible, it's better for you all to set everything up in Infinite Campus using the blended learning functionality, because if you set it up in the way that you would have done virtual performance-based courses in the past, the problem you're going to have is that you can't then record participation for daily for kids who are in a virtual performance-based course. You do that based on the fact that the student completes the course at the end of the time, then you get full participation. It's like pass-fail. So you get nothing or you get all the participation. For most of your situations, that's going to be problematic because we're going to be pulling, and I'll mention that in just a second, the participation data at points during the year. And you're either going to, if you have kids in virtual performance-based courses like you would for a credit recovery program or something like that, or a dual credit class, which you would still keep in that performance-based model. But if you're talking about these virtual kids that you've set up in a virtual academy, you need to make sure that you've used the blended learning functionality, because that allows you to record daily participation for those kids. So when KDE pulls that report, when we will, you've included those kids. If you have them in a performance-based class, when we ask for that information, those kids would not be in there, and you would have had to be collecting their participation data some other way, and then submitting that to us in a separate by a separate process, which is just more complicated. Is the reason I mentioned that. Next slide, please. So the last thing I'll say is we're going to collect participation, district level participation. You're going to be reporting your district level number just like you did in the spring. And that will happen in October of 2020, in January of 2021, and in July of 2021. That report will be pulled from IC. It will be shared on the KDE website. It will also be shared with the Legislative Research Commission, the legislature, so they can see where districts are in their participation numbers. I would point out that because this question has come up and we didn't put it in the guidance document for reopening schools, but districts, we're not going to be doing a separate SharePoint site for NTI for this year. So we're just going to be looking at the participation information that comes to us from IC. There's still obviously opportunities for audits and monitoring of NTI. So you still need to be mindful that if you've put down on a participation for a kid for a day that they had work on the LMS, somebody may come back and say, can I see that? Or can I see the record or the log of that? So, but you're not going to submit it to us as you have in the past through SharePoint as a regular daily or weekly process as you have in the past. All we're going to be collecting on the sort of just in time will be the actual participation information from IC. So I wanted that to be pointed out. I think that's the last slide I have, Tony, or whoever's running the slides. So if there's any questions, Kevin, I can do those now, or we can do it at the end.
Tony, let's take a few now, no more than 10 minutes, so we'll have time for the other items, and then so we also have time for the general question answer session.
Okay. Going back to the soapbox on NTI. Will we keep track of tardies each day for students attending in person?
That might be a Robin / her team question.
Yeah, that is a good question. And I honestly will share with you, I hadn't thought about that. So it's a really good question that we need to think through. I've sent that on to my staff that that will be dealing with participation. And we will circulate an answer on that as soon as we can. But that a very good question. Thank you for submitting it.
Okay. Let me go and look here. So I'll just go ahead, and this is the top question in the soapbox that just can kind of that I think the commissioner said he would address. We're dealing with the reduction in group sizes in terms of class size, and will it impact our classes to have fewer than 10 individuals?
So I think this is regarding the announcement made by the governor yesterday, which was in reference to an order issued yesterday by the Cabinet for Health and Family Services. This order about 10 reducing the number of social gatherings from 50 to 10 is for social gatherings only. It is not related to business entities, and by comparison, not related to governmental activities. I think some of the questions ask if the governor's order yesterday on bringing that back down to 10 applies to professional learning for staff. It does not. That's not a social activity. At least I guess you can make it more fun, but it's not a social activity. And so your professional learning, for example, needs to follow Healthy at Work. If you're having a retreat, it needs to follow Healthy at Work. School board meetings, not social. Again, follow Healthy at Work, and other guidance that's previously been issued for meetings and gatherings of that type, and also does not apply to classrooms. And I'm reading the order now, and also in the governor's comments yesterday, it was very clear that that applies to social events only. These are, and the reason for that is, I think due to contact tracing and knowing where some of the cases are coming from, seeing an uptick. It's the summer after 4th of July, family reunions, barbecues, weddings that may be occurring in homes, that kind of thing. You're seeing an uptick. And so that is why that was issued, because your family barbecue is not regulated by the state. Your school board meeting is by definition regulated by the state. So we assume, and the cabinet assumes, that you're going to be following protocols because you're part of the state or you're a business entity regulated by your license or other means.
Okay. Looking to see if there's any more NTI in here. There's a couple more special ed. Nope. I think, David, you may be off the hook for now.
All right.
Okay.
We're quickly approaching the 4 o'clock hour, so let's move on quickly. David, thank you. Hang around. There's likely to be more questions about yours. We will move into guidance from Kay Kennedy related to procurement of personal protective equipment and supplies. I do want to state that we are providing this to you at your request. Several superintendents requested that we inquire as to whether the state contracts through the Finance and Administration Cabinet that are available to you to purchase from include PPE. Also, have received some inquiries from the members of the General Assembly about whether or not districts need to or can utilize contracts with third-party service providers that you may need to do deep cleaning in addition to the cleaning that your custodial janitorial staff are doing in your building. So this is related to that. I want to be very clear, this is not to replace and is not intended to compete with or interfere with the relationships you have with your cooperatives, who also have price contracts and are bidding on your behalf for PPE and other services. This is in addition to, in case you are unable to get PPE from your normal services or a normal provider. So there have been a few questions about that overnight. Just want to make sure you understand why we're providing this to you. This is just one more tool in your toolbox and another potential source if you're unable to get it from other areas. Okay?
So thank you, Kevin. Did you get a copy of my script? I really have nothing else to offer. Did we have another slide that got in the mix, Tony?
I'm looking to see. It looks like no, it did not.
Okay. Can I share my screen then?
Sure. Do you want to? Yeah, go. I was going to say we could show them on the website where it's at, but go ahead.
Well, that's what I was going to do, unless you have it already up.
Go right ahead.
Okay. Can you see my screen now?
Yes.
Okay. Under the reopening guidance that has both KDE and non-KDE resources, we've added a tab that's personal protective equipment and supplies. On that, you will see 3 documents, one that lists janitorial cleaning services. These are non-state contracts, just those vendors who are available. And then we have listed those who are on state price contracts as of July 16, 2020. Pretty much on a daily basis, I am getting contacted by vendors who have supplies or services to offer. And I am directing them to make contact with the Finance and Administration Cabinet to do business with the Commonwealth. I'm directing them to the directors of the co-ops in case those organizations are interested in establishing any purchasing agreements, as well as pointing them to contact information on our website for individual districts should they need to reach out or want to reach out to you individually. But again, with respect to how you do business with these vendors, the Department of Education has not vetted any of these. I do feel a little better when they go through the Finance and Administration Cabinet in terms of a contract, but we don't really have the capability or the manpower to do that type of review at this point in time. So again, those lists are out there. Your finance officers may need assistance with how to navigate some of those state contracts. And if that's the case, just reach out and we will try to help them through that. But that's all we need to show about the available procurement opportunities for cleaning services as well as other products. So I will.
Thank you, Kay.
Stop sharing my screen. Okay.
And then our
Tony?
next, the next item on the agenda just goes right into DPH. And I was just going to ask if, not sure if that, yep, Connie White is here today. And Emily, do you all have any updates you would like to share with us, or do you want to go right into our question and answers? You are on mute.
I don't have any specific updates.
Go ahead, Dr. Messerly.
I was just saying I don't have any updates. Unless you do, we could go to questions.
Yes, and I wanted to thank the KDE team, Robin and Kay. They were on our equivalent to this call with our health department directors this morning, and it was nice that they said the same thing that Dr. Messerly and I have been saying. That's always good when it's the same story. So that was good. Thank you for doing that today.
Great. We also want to thank you in advance. We know that you all, as well as Dr. Stack, will be with us for the town hall on Thursday. So again, so we appreciate that. All right. So going ahead to back to the Q&As. So first up, the question says we need guidance on options for signature through the virtual option, one that is legal and cost effective. So I believe that it's going to be for Team KDE.
Does that say again, signatures?
Yes. Options for signatures through virtual option, one that is legal and cost effective.
Are they talking about, Kevin, are they talking about like signatures on a document for registration for a virtual program, or I don't?
I'm not sure,
like
but it was like
electronic signatures or something like that.
Commissioner, I'll jump in and say that we've previously provided some information that I believe Associate Commissioner Hilton has sent out in some of her guidance regarding the required form and legality of electronic signatures in the Commonwealth. That is a matter of state law that is set forth by the General Assembly, and I know that some of her guidance has included that as it applies to IEP, team meetings, and special education documents, but I believe that would be applicable to all other documents in a school district as well. We can recirculate that.
Absolutely. And if, thank you, Todd. And if the person asking that question could reach out to me directly, then we can get it to you in an email this afternoon.
Okay.
And I believe I've just learned that's question number 5 in April's FAQ document on the COVID-19 KDE page. So I believe that's what Carol Ann was referencing.
Yes, and for everybody Go ahead.
Sorry. It's actually on our OSEA COVID-19 resource webpage. There's an FAQ document from April 2020, and it's in there.
Okay. All right. And just to reference, the document that Kevin is talking about is updated pretty regularly. So I think it was last updated on Monday. And so that is also on the COVID-19 resource page. And that is all of the questions that have been asked during these webcasts and other advisory meetings. And it is a Google form, so you can search by word or topic. And again, that is available. We shared the link through the KDE social media yesterday. But if you have a hard time finding it or locating it, just let me know. The next question is for teachers who have been to other states mentioned by the governor and should be self-quarantined. Do we enforce the governor's quarantine mandate or recommendation and tell them that they can only join virtually?
Are you asking me?
I'll let you kick us off, Dr. White.
Thanks so much, Commissioner. I take it from his conversation yesterday that he feels that should start right away. And so I would say that from the time that you returned, there is an expectation, at least from the governor's office, that you will self-quarantine for 14 days. I hope that doesn't interfere with starting the school, but do you have any insight on that, Commissioner Brown? You're over at the governor's office more than I am.
That is a recommendation. It's a very strong recommendation. I think the governor alluded to the fact that was termed in that way due to some court decisions about how those types of travel restrictions needed to be phrased. Like Ohio, I think, has similar verbiage. I believe if you have a case of a teacher that's, maybe they're having a vacation at Destin the week before we start school, and you're going to bring in-person classes, you're going to have in-person classes, then I think that's got to be a conversation that you have with your local health department that you're already working with about, Mr. Brown's coming back, he was in Destin, how should we handle this and the risk associated with it. Dr. White, do you agree with that?
Yes, because we are trying to categorize cluster outbreaks now. Some happening with the athletic organizations, but most of the new ones are travel. People that went to Myrtle Beach, or people that went to blank beach. You put beach at the end and put anything in front of that, and it seems to have been an issue. So we are seeing people coming back from vacation. We had somebody that works in this cabinet go on vacation to Florida last week and rode down there with someone who wasn't feeling well. And when they got to Florida, found out they were COVID-19 positive. I can't imagine why somebody that works in this building would go to Florida for vacation, but it does happen. And the consequences could be spreading that infection to other people. So that's the governor's recommendation, and I think we support that. And we at DPH certainly feel that way.
Okay, so related to that question, so it was kind of the same question. Can a school or district restrict a teacher from coming to work if they have traveled out of state? If so, for how long? And then the follow-up is, and would they have to use personal time for quarantine due to travel?
Todd, this is getting into public health, but also personnel issues, legal issues. Can you chime in with us on this one?
Sure, we can take a look at that and look at it in some additional detail. The Families First Coronavirus Response Act does provide some federal leave time for individuals who are subject to a quarantine order by state or local government. So we can take a look at that and provide some feedback. The United States Department of Labor has a great question and answer section on their website that I would encourage all school district superintendents to go to and check out, that answers a lot of these questions about the leave that's provided and federal and state quarantine orders. But we'll look at that specific question and see if we can get a response to it.
Okay. Do we have specific guidelines for after-school care?
Go ahead, Kay.
So this is Kay. So the question has come up about after-school care, and I think it is dependent upon the circumstances around your care. If your after-school care is directed toward the students that are in your building or equivalent to your building, where you're just providing sort of an extension of your school day, we would expect that to be operated under the same conditions as your school operated under in terms of social distancing, masks, hand hygiene, etc. If there are children from another school who come to your school, another school in your district who come to that school, they would have to have their temperature checked upon entry into your building. I think just sort of in a nutshell, the guidance would be as long as you're servicing school-age children, that you treat it like you would a normal school day. Dr. White, you want to add anything else?
No, I think that covers it well. Thank you.
Tony, you want to take us to the next question?
You're on mute, Tony.
Let me take myself off mute first. The next question I have is regarding state assessments. They want to know when discussions will begin regarding state assessments for spring 2021, i.e. K-Prep, etc.
Those discussions are going on right now. I attended a virtual meeting with the chiefs from the the chiefs that are part of the Southern Regional Education Board area, the 16 states as part of SREB. Dr. Glass also was on there with me since he's the incoming commissioner. And so those discussions are occurring. I've had those discussions with Dr. Glass. We know that they're occurring regionally, as I just described. Council of Chief State School Officers, chiefs are discussing. And then, of course, we know the Georgia Department of Education, through their commissioners, has already submitted a waiver to the U.S. Department of Education asking for relief for the 2021 spring testing. Our staff here at the department, they are researching that waiver to see the language that's in there. It's my understanding, I haven't read it yet, but from talking with that chief from Georgia, they understand that if any waivers are granted by USED this year for testing, there will probably be strings attached, meaning probably not going to, they're probably not just going to say like we had last spring, just due to it was just such an emergency that, okay, testing is off and that's it. It's off. You don't have to do any testing. I think now, and this is my opinion, and Georgia went ahead and offered a alternative to testing using some formative measures in lieu of their state high stakes testing. So it basically, Georgia is saying we want a waiver from high stakes testing. Instead, we want to implement low stakes testing, but testing that would still result in formative results that will give us feedback on how our students are doing so that we can immediately provide a remediation acceleration for them. And again, that's me just generally summarizing what's in Georgia's, what I think to be, based on that conversation, is in their application for waiver. So we're thinking about it. I think the big question is a Trump administration, U.S. Department of Ed going to be interested in waiving assessment this year? And, it could also be another administration. So it's not been decided. That will be something that I'm going to defer to Commissioner Glass, Dr. Glass, and he will be having discussions with the state board, and will continue to monitor and know that that's something that, obviously if we know about that, the earlier the better. But the spring is still a bit away. So that's just an update on where we are with it. No final decisions in Kentucky, monitoring it. Believe that there will have to be some type, in my opinion, of if there is a waiver afforded from the feds, I think they're going to want us to say, well, instead we're going to do this where we're going to be able to show that districts did this in a formative way using diagnostics and others types of assessment along the way to take the place of those high-risk tests for that year.
Okay. The next question is, our parents want to know if a child has an exemption for wearing a mask, will parents of other children in the class be notified?
I don't think that's me.
I'll jump in really quick on this one, Tony and Commissioner. It sounds like the question is if there is a medical exemption for a child to not wear a mask within the classroom, will the other parents of students in the class be notified? Typically, we don't make notifications of medical accommodations that are provided to other students. So what we do, you can kind of compare this in a way to a situation if a student needs and has a service animal in the classroom or even in your workplace. There may be other individuals who are allergic to animals. We have to accommodate both of them in that situation. So that seems to be the situation that we're dealing with here, and would be similar to the question that was asked earlier about other students in the classroom who have some type of exceptional healthcare needs. We're going to have to look at both students and how we accommodate both of them, because they both come to us with some type of medical need that needs to be accommodated.
All right, the next question is, does the 72-hour fever rule apply only to those diagnosed with COVID or with those symptoms, or does it apply to all fevers this school year?
Well, that's something that we've discussed at our last meeting last Thursday. We had said 72 hours. There's some new guidance out from the CDC, so I think we're going to have to look at that and make sure that needs to be changed to 24 hours. And I think we'll have that something definite about that by the Thursday call, or certainly by this time next week.
And then Dr. White, what about a student that might be exhibiting a high fever for something else? We treat it all the same though, correct? Until they get a diagnosis from another physician. Of course, we don't want a student at school if they have a fever regardless of the underlying reason, but they're to treat that the same.
Correct. Yes.
Okay. The next question is, what is the difference between, sorry, it just got moved. What is the difference between a 10-day and a 14-day quarantine if someone has COVID or has a household member that has COVID? I am hearing two different time periods for quarantining staff and students.
Okay, that is confusing. That was confusing for me at the beginning. So the difference is, one is quarantine and one is isolation. If I am COVID positive, I will be isolated for at least 10 days. And if I go 10 days without any symptoms and with no fever, then my isolation period is over. I've gotten the illness and my illness is over because I've had 10 days of no symptoms. If my husband, on the other hand, who is in my household, would need to be quarantined for 14 days because it's a 14-day window before he would start exhibiting that he might have this illness. So it's two different time periods for two different things for two different reasons. So the isolation can be as short as 10 days, could be up to 14 if it's for me to try to demonstrate that I have resolved my symptoms of COVID-19. If you are exposed to someone with COVID-19, then you need 14 days to show that you are not going to exhibit symptoms of COVID-19. I hope that clears that up.
Okay.
This is
all right.
This is Emily Meserly. I just want to make one quick comment. We our local health departments and their leaders are so supportive of us during this, and we received I just today received some really excellent tools that are flow charts and algorithms for when people test positive and what do you do and how long do they stay home. And I will be reviewing those with Dr. White and Dr. Stack, and then sharing them with the KDE partners if we feel like those flow charts are appropriate for the school setting. But we have some really good resources that we'll be passing on to you soon.
Thank you.
Okay, the next question is, we were planning a graduation ceremony for August. Is this considered a social event?
I would say yes. Dr. Commissioner?
I'm assuming that is because they were waiting, hoping that they could have in person. So assuming that that's in person, I think we're probably going to have further discussion. That's a social event, but it's operated by a governmental entity that's regulated. So, Tony, if you could get the information from the district that sent that in and have Kay follow up with them and get the details, probably have to have a offline conversation with public health about that. And there may be other districts similarly situated that have deferred.
Okay.
I remember a lot of districts when we were talking in May were planning on doing things in August.
Okay. Sounds good. The next question is, masks. When a student has been granted a medical waiver and is allowed to be in a classroom without a mask, this kind of goes along to what Todd was saying earlier. How do we handle the question of student health and safety for other students when we begin to hear from other parents of kids in the same areas in classrooms?
I think what the question is saying is that if one or more students have, even if they are legitimate waivers from wearing a mask, that will cause other parents who would normally send their children with masks to be in that classroom reluctant to do so, because there's going to be at least one child without a mask on, and thus increasing risk, or
Correct.
in their perception, increasing risk.
Yeah, the fewer masks you have in the room, the more exposure everyone has. You're absolutely right. And just to be clear, there are very few medical exceptions where a child cannot wear a mask. Doesn't want to wear a mask, or the parents don't want to wear a mask is one thing, but medically, there are a few exceptions, and a child with an asthma condition that is not severe definitely needs to be wearing a mask, because this is the very child that doesn't need to be exposed to COVID-19. So I've gotten several emails from pediatric practices saying, please help us out here, because we've got people calling 20 a day saying, if you don't give me a mask, I'm going to leave and go to another practice. I'm concerned about how this is going to go down in the medical community, because this person was saying, and I'm not going to give them one if it's not medically indicated. So this is going to be something that we've talked about inside conversations, and I'm not sure how you legislate this, but for you as non-medical people, there should not be a lot of medical exemptions for a mask. That just doesn't exist that often.
I think the question is does KDE staff also, how do they handle that question? Do we have any suggestions from staff on how to handle that question from those other parents who may be concerned?
Tony, this is Todd. I would envision if a parent came to a school administrator and asked about a student, being in a classroom not wearing a mask, I think that the school could generally explain that there may be a very small handful of students who have a medical exemption from wearing the mask. The school isn't permitted to disclose who those individuals are or what their medical condition is that exempts them from wearing a mask, but the school should be able to explain to the parent the steps that they have taken to ensure that individual is a safe distance from all of the other students, since they aren't able to wear a mask, so that if that student coughs or sneezes, they aren't expelling respiratory droplets onto staff members or other students in the classroom. I think they need to be prepared to communicate with parents about that without identifying any specific student or medical condition of those students.
Okay. All right, we're right at 3:59. So
Yeah.
we still have several questions, but I know that Kevin, we had just received word right before the webcast started that the district emergency leave during the 2021 school year memo that Kevin had issued was signed by the Lieutenant Governor. Kevin, did you want to talk a little bit about that?
Based on feedback from districts and others, we have issued the memo that waives the prohibition of more than 3 emergency days. This is the same relief, or will be the same relief after the state board passes a emergency regulation at their August meeting. This is the same relief that you receive for emergency days for your staff under Senate Bill 177 related to COVID to close out last year. So the state board emergency regulation will mirror that language in that Senate Bill 177. I've heard from several of you, including one here just a few minutes ago, Superintendent. There is some concern about staff that may be seeking emergency leave or other leaves for reasons of convenience, not necessarily medical reasons. We'll be talking to you all offline, and that will help us with our reg language. That's not what that's intended for. It's intended to provide for the boards, local boards of education, to determine if you want to offer emergency leave, then you can have an unlimited amount of days if you choose that to offer it related to COVID. So we believe you can provide some parameters to that. We will continue to discuss that, knowing that you all have those concerns, and that will help us draft that emergency regulation. Finally, I will mention to you last night, K-12 education was very well represented on Kentucky Tonight with Renee Shaw. We had 2 superintendents, Superintendent Schultz, Superintendent Faulkner, several teachers, Eric Kennedy from KSBA, a state board member, Kelly Foster from the department. I know I'm leaving some people out. Anyway, it was a great, of course, discussing very tough issues though, and some questions that really don't have easy answers. But if you did not watch Kentucky Tonight, I encourage you to do so. You can find that on the KET website. Despite the nature of the questions and the what we're dealing with right now, it was nice to see the education community there with their expertise, with a hopeful eye to the upcoming school year. Hope you all will be able to join, and your staff can join the town hall on Thursday. We'll be back again here for another webcast on Tuesday. Tony and staff, will you please flag those questions that we didn't get to today and read those at the beginning of next week's webcast? Anything else, Tony, to close us out?
Yes, and just wanted to let you know, we will get that memo out. It literally was signed just as the webcast was starting. The memo, as well as some guidance documents on regarding to that memo, will come to you this evening, hopefully here within the next hour or so. And that'll come from Interim Commissioner Brown's email. It'll also be sent out via media release.
Thank you. I encourage you to watch the governor's press conference. As I said earlier, always information related to K-12 education on there. I believe the Lieutenant Governor will be making some comments at the presser today related to the same subject. So everyone have a great evening, stay cool, and we will see you online. Thank you. And Dr. White and Dr. Mesley, thank you again.